I said earlier, it's very important to see the faces behind the research, faces behind the innovative advances. It's also crucial, I think, to see the faces behind the statistics, the people affected by cancer. And what we'd like to do is to really hear a fascinating story, an inspiring story of a pancreatic cancer survivor, someone who's actually now dedicated themselves to the fight, to the good fight, as my mother would have said, and involved in an action plan, an action group in Japan. And I'd like to call to the stage, please, now, Yoshiyuki Majima, a pancreatic cancer survivor.
Hello, everyone. Good morning. Bonjour. First, I'd like to thank the organizers for inviting me to speak today. I'd like to talk about my 20-year journey of facing pancreatic cancer and share that with you. This is an old statistics where when we started the PanCan Japan, you could look at pancreas, of course, has the lowest survival rate. And for a long time, like over 40 years, pancreatic cancer survivors' survival rate for five years was single digit. But now that's started to change slowly. When we started our activity in Japan, we've known Pink Ribbon Campaign. Everybody knows Pink Ribbon Campaign, right? It's for breast cancer. But nobody knew about the Purple Ribbon. I'm wearing the Purple Ribbon badge here, but people didn't know. And Purple Ribbon thought that, people thought that it's like a domestic violence symbol, but we had to tell them that it symbolizes pancreatic cancer. So we started to do a Purple Ribbon Campaign in Japan, visiting each major cities and give them the latest treatment plans to physicians. And through our experience, we went to Hiroshima, city of Hiroshima, where I met this lady. And her physician told me that she is a patient, and also her mother is a patient. So he wanted me to meet them, so I said yes. So we're going to meet, but they did not show up that day. Later, she sent me this letter, so I'd like to read it to you. Dear Majima-san, my mother passed away. I thought my mother would finally meet you, but she passed away on that day, as if my late father had come to take her on his birthday, September 29th. But why did both of us get pancreatic cancer? The onset was around the same time. While I was taking care of my mother, her condition worsened rapidly. It was so painful. I didn't know what to do now that I'm still alive. Since she was hospitalized, my mother kept saying, "It's probably genetic. I'm sorry. I'm so sorry." I sincerely hope that everyone will learn about the Purple Ribbon Campaign and that no one will ever have to experience the sorrow of losing a parent to pancreatic cancer, Noriko Hirohata. She sent me this letter, and I was able to see her, but she passed away the next year. My journey of pancreatic cancer started with my sister. Phone call from her telling me that she was diagnosed to have a pancreatic cancer stage 4. At that time, she was only 48 years old, and a 12-year-old son that she was looking forward to raising him. But she was told that she would live 3 to 6 months. And our fight against pancreatic cancer felt like this. No-win situation. So we talked to her physician, "Is there anything you can do?" And he told me that, "I'd like to, but I cannot fight against pancreatic cancer with bare hands. I need weapons." So at that time, we wanted to shout that we need more drugs now. We can't wait. patients only have 3 to 6 months, they cannot wait. After she was gone, I started PanCan Japan to take a revenge on pancreatic cancer. And we started to build a community. And we created a network and a membership and went over 1,000 members, but we lost most of them, unfortunately. And our PanCan's 3 missions: advanced research, patient support, and advocacy. Advanced research is very important. It's the theme of this conference. We look forward to hearing it today. But in Japan, we need advocacy as well. I was fortunate enough to meet this doctor. She's from a former Osaka Prefecture Adult Disease Center. She was the director of health screening. She told me that pancreatic cancer can be cured if diagnosed early. But the problem is, it is rarely diagnosed at early stage. And she showed us this. This diagram says that if a patient can be found at stage 1 or stage 2, 5-year survival at that time was better than 50%. But you can look at stage 1, 2, 3, 4, the number of patients. Stage 1, 2, very few. Most of the people, just like my sister, were diagnosed at the stage 4. So even to give a hope to stage 4 patients, we need more effective drugs. I was fortunate enough to meet Dr. Ralph Rubin in Japan, and he told me that I could come to Johns Hopkins and write an article. So I took an opportunity and visited. Then I learned this. They have a National Familial Pancreatic Tumor Registry, and I thought, we should have that in Japan as well. So we worked with physicians in Japan, and we created NFPTR in Japan in 2012. It took 4 years, but we did it. And now, as for me, I lost my sister at a young age that I was told that I might have a familial pancreatic cancer risk factor. So in addition to cysts and dilated main pancreatic duct that I had, now I have 3 different risk factors. And Dr. Tanaka put me on a surveillance of 4-month interval. And at 1 year, I took a PET CT, and the PET showed a slight FDG uptake. 6 years later, I had oropharyngeal cancer. I like to show it to you. It's really big, red, bright spot. But in comparison to that, mine was slight FDG uptake. But my surgeon said I should have a surgery right away. And I asked a lot of other doctors. They said, no, total pancreatectomy is not for you. And a lot of doctors were against having a total pancreatectomy. But I'm so glad that I took it. These are the risk factors, and this is after the surgery pathological report. You look at, blue dots, they're PANN1, IPM with low grade. Yellow ones like a PANN2, and pink ones CIS, carcinoma in situ, IPM with high grade. So if only the head was taken, I might have, developed pancreatic cancer. So I'm so glad that my surgeon insisted that I should have a total pancreatectomy. Now I'd like to talk about fight of PanCan. This is taken from a 2020 campaign that we did in the United States, Wage Hope. Our headquarters put a goal of, by 2020, double the survival rate of pancreatic cancer patients to a double digit. Remember, it used to be single digit? Now we had a tall order of aiming that, and luckily, we approached it. Now it's the 5-year survival rate in the United States is 13%. Pancreatic cancer in the United States is the 4th leading cause of cancer death. And it's going to become 2nd leading cause of cancer death in the United States by 2030. So we have to really work hard on this. And now the new goal is by 2030, double the survival rate from 10% to 20%. That's our goal, and we're working toward that. In Japan, we have a different attack plan. This is what was shown in the 2020 ASCO. And this shows that, if a pancreatic patient was found to have an actionable mutation, then if that person is given a matched therapy, they can live twice as long. So we wanted this to be in Japan as well. And these are the, you already know this, but if we have the KRAS inhibitor, more pancreatic cancer patients will benefit. So this is what we face in Japan. It used to be that, FDA will approve a new drug, then the clinical trial will happen in Japan, then that drug gets approved by PMDA in Japan. But that cycle took 5 to 6 years. Remember, pancreatic cancer patients are given only 3 to 6 months. They cannot wait 5 years. So now our job is to make the government faster approval process. So we collected signatures from more than 30,000 patients and family members and friends, and submitted to the Minister of Health, Labor, and Welfare, and asked him to help us approve the drugs faster. And this is taken from 2015, 2016. That has gotten faster and faster. So now it takes less than 2 years for the government to approve new drugs now. But that's not the end of the story. So this is a patient quote. The current treatments aren't good enough, no matter what stage we're diagnosing. So what? What can we do? The worst part is physicians have to tell us that I cannot do anything anymore for you. Go home. Go home to what? It's a message that nobody wants to hear. So let's change that. So the doctor can say, let's try this one. Let's try that one. There's a new treatment. Let's try that. To do that, we need more efficient drugs. And unfortunately, in Japan, only 10% of patients receive matched therapy that we talked about in Japan, and only 28% of new drugs, if FDA approves, reaches Japan. So we have to change that. The next quote from patient. I've heard that pancreatic cancer is difficult to detect early. This from 2008. If that's the case, please create a system that can detect it early. Yeah, of course. That's a great idea. So what can we do? Let's change too late to just in time so that we can save pancreatic cancer patients. Together, we can make early detection the new standard. It's been almost 20 years since 2008, but we still have not seen that in Japan yet. So I look forward to hearing good news through this conference. So this is a picture taken from 2008. Everybody's raising hand. Get rid of pancreatic cancer. No more pancreatic cancer. A lot of survivors in there, but they're all gone now. Some of the doctors, they're all gone from, some of them are gone from lung cancer as well. So I like to end my presentation with this quote from a patient. I want to leave behind the words, thank you, before I go. Thank you to everyone supporting me and fighting this disease. Thank you so much. Let's create more survivors. Thank you very much.
Yoshi, thank you very much. Inspiring words, and also somebody really involved in the fight in Japan. So an incredible journey for Yoshi. We are going to be taking questions from the audience, so from you in the room. We have 2 floating microphones, and in fact, throughout the day, as we hear from different speakers, keynote addresses, panel discussions, we're always going to give you the floor. We're going to pass the microphone. Also, on your badge, you have a QR code. And you're able to type into this your question if you prefer, if you're a little bit shy. So either the microphone, you can tap your question into your mobile phone. And for those online, so for those watching us from a distance, you also have the option on the website for putting in your question. And so I'd like to invite Yoshi to join me now for some questions. Don't hesitate to raise your hand if you have a question for Yoshi. We have time for lots of questions, also for those online as well. Maybe I could start, Yoshi, thank you very much. And, let's try this. That was a phrase that really, was a highlight for me in that presentation. Let's try this for medical professionals. My first question to you, Yoshi, would be, what do you say to someone who comes to you who's worried about pancreatic cancer? Maybe it's in the early stages, maybe it's in the family. What's your top advice? After all these years, what do you say? What are the first words?
Now we understand that a person can go to a high-volume center where pancreatic cancer patients are treated in volume. That's very important for those who are surgical candidates. And also chemotherapy and some of the genomic medicine is coming into Japan as well. So find those hospitals that are that can do a gene profiling test first of all, and then the following treatments as well. You have to find the right center to receive these benefits.
And it's also getting the right advice, because you talk there about, is it a partial or a full removal of the pancreas? How do we cope with that when we have lots of different advice from different experts? How did you cope with that?
At that time, I didn't know, and a lot of people didn't know that new device was coming on, so that after total pancreatectomy, patient will become a type 1 diabetic. And it's a terrible in those days. Person may become brittle diabetic and have a consequence and die. But I'd like to show it to you. Insulin pump that I'm wearing came to Japan in 2014, 2 years after my surgery. So now I'm wearing insulin pump, so I don't have to inject myself with the insulin and measure blood sugar level, because this constantly monitors, and so it's good that we have this kind of device. And also I have to have a pancreatic enzyme supplements, and this comes from Germany, but we benefit from this kind of pills as well. So things are not staying the same. Things are getting better each year. So surgeons should have this kind of information now. So I suggest that they should go to a high-volume center for better surgery. Yeah.
And so it really does depend on where you are as well, what is covered by the National Health Service, etc. In lots of countries, perhaps these treatments wouldn't be available. When people are coming to you, are they concerned about that? You mentioned in your presentation, we need more drugs. Know your tumor. That was another phrase that stuck out for me. In Japan, would you say that we're ahead of other countries when it comes to the coverage and the treatments available?
I didn't know this, but after talking to patient groups in Asia, I learned that Japan's national health insurance covers the gene profiling test, and there are 5 different gene profiling tests that are covered under the insurance. And so in that sense, yes, we have benefits, but unfortunately, I told you that only 30% of new drugs are coming into Japan, so it's a mixed blessing.
Okay, Yoshi, don't forget that we're taking questions from the floor. I don't know if anybody in the room has a question for Yoshi. Also, people online, don't hesitate to ask your questions. Do we have a question in the room for Yoshi? Yes.
Good morning, Majima-san. Fred Holland from the University of Melbourne. I'm taking you back to the comment you made about prevention and early detection, which I think is crucial. Primary care physicians, GPs, are an essential partner in that network. They're not necessarily that well trained to recognize what may be or may not be a pancreatic cancer because the symptoms are so, indiscriminate. Just curious to know what the situation in Japan is in terms of trying to link the GPs with the whole of the system and trying to refer those patients to the right center.
Thank you for a great question. In Japan, the GP and the specialist are creating a team. And we see that spots throughout Japan, but it's not a standard yet, but they're working to screen the people with multiple risk factors of pancreatic cancer. If the person has multiple, not just one, but 2 or more, then they're suggested to go to a GP and have an initial screening. Then if the GP finds something skeptical, then the GP would refer that patient to EUS specialist or a teaching hospital where they can have a screening like MRI, CT scans, and EUS to go and try to find if there's anything really there or not. So that kind of screening system we'd like to see more developed in Japan and elsewhere too. But when I talk about this to other countries, pancreatic cancer patient groups, they said, no, we don't have EUS specialists in our country, or we don't have enough CT scans, or, different situations exist in different countries. So I cannot really say that this should be done everywhere, but GP and the specialist can work together and screen and find early pancreatic cancer. And that's what's happening. I'm the specimen myself, so it can be done, yes.
And great to have the patient perspective as well, with an action group, so the patient's voice heard as well. Great question, thank you very much. And we'll be drilling down into lots of issues to do with early detection and a lot of the other panel sessions coming up, right down to the technical medical details. Any other questions in the audience for Yoshi? Any other questions? Also, people online. I have a little screen in front of me so I can see the questions from people online. Don't hesitate to tap into your phones. Yes, we have another question.
Thank you. Good morning, sir. Thank you very much for your words. I'm Dr. Elisabeth Weidepas from the International Agency for Research on Cancer, the World Health Organization. We have recently published on the effect of alcohol drinking on pancreatic cancer. It's now established alcohol drink does increase the risk of pancreatic cancer in a dose-response manner. The general public is not aware of it. Are cancer patients and your organization aware of it? And are you also working in awareness for risk factors for pancreatic cancer? Thank you very much.
Well, thank you very much for a nice, good question. Yes, I explained about the Purple Ribbon campaign, which is to tell the general audience about the risk factors of pancreatic cancer, and drinking heavily is one of them, and also pancreatitis is one of them. So we're doing that. And to see the effect from those general awareness building campaign is something that we really have to focus on. We do research as well, our group, and do a survey questionnaire and everything. And we're also working with the local government in Hokkaido, Sapporo, because they have the hardest death rate from lung cancer and pancreatic cancer. So we're exactly doing that for the past 15 years of risk factor awareness campaign. We have to see what the effect would be. Thank you very much.
Okay, thanks very much. And hot off the press, some questions from our online audience. One question from somebody online. What results did the Familial Pancreatic Cancer National Registry produce? And how is this information utilized? How are we using that?
The database is controlled by the Japan Pancreas Society's registry group. And I'm not sure what they're doing with that registry per se, but people who register are under the surveillance. And if they raise their hands, they could go through exactly the same kind of procedure that I went through. So hopefully they'll find more patients at an early stage, like stage 1 and 2. I like to see the published report from them, yes.
Yeah, it's always interesting to have the data and the sharing of the data,
Yes.
not just international, but also nationally as well. Another question online, what types of early detection methods are being developed, particularly that you're focused on, that you're involved with?
Recently in Japan, I guess last year in April, that blood test to find the early pancreatic cancer was approved by the National Health Insurance. So now we have a blood test available with a very high sensitivity. So if the person's interested in it, they could have that test.
Okay, great. Thank you very much. Any other questions in the room? Yes, we have somebody raising their hand here on the left. A question up here. Thank you very much.
Thank you very much for the presentation. Delia Nicoară from the Oncology Institute in Cluj, Romania, but also representing Prevention Task in UNED CCC. I have a question related to the general practitioner. Who is training them? Because that's really interesting. And I don't know if the medical university, or do you have additional training for the GPs in order for them to learn how to detect?
Screening. It's not the entire country, but it depends on a section of country where GP and specialists are collaborating together. And we like to see more of that, but sometimes it's difficult for a GP to collaborate with a specialist who are in the teaching hospital per se. But there are spots all around Japan that they both of them are collaborating, and the GP have the algorithm of screening patients who are worried about whether they have a pancreatic cancer or not. And that algorithm says that if that person has more than one risk factors, they're entitled to having a certain procedure, and that will lead to teaching hospitals specialists for EUS and so forth.
Okay, Yoshi, thanks very much. Also a question here online, how do we access genomic profiling and testing? That can be a question for a panel a little bit later on when we drill down into some of those details. So thank you very much. Lots of questions. Don't forget, you'll have a chance to ask your questions for each speaker, each panel. And of course, we'll be overlapping a lot, aren't we, on some of these issues. But Yoshi, thank you very much. Thank you very much for sharing your story.